The parking lot is empty. Not a single car. The concrete is cracked. The sign says, all you need to know. Hospital closed. If you have an emergency, dial 911. This is Rockdale, Texas. The rural community of 5,600 people is a poster child for what is taking place across Texas and many parts of the United States.
Be advised, I sent off those 4 gas monitors for repair. We should have those back by midweek next week.
Ward Rodham is chief of the Rockdale Volunteer Fire Department.
I grew up in this community, right? And my wife grew up in this community. We raised our children in this community, and there was always a hospital.
Not anymore. In 2018, Little River Healthcare closed its doors. Since 2010, 26 rural hospitals have closed in Texas. That's more than in any other U.S. state. Consider this. In 1960, there were 300 rural hospitals here. There are 167 today, and the outlook for many of those still open is bleak. John Henderson is president of the Texas Organization of Rural and Community Hospitals.
National data shows that 44% of rural Texas hospitals had negative operating margins in 2019. More than 60 of them had less than 30 days cash on hand heading into the pandemic. So things were bad and they got a little bit worse.
Okay, we've sealed off that zone. There are 6 beds in there. That's a COVID unit.
Worse because COVID-19 forced many hospitals across the U.S. to stop elective surgeries. And the fear of the disease kept many people from going to the hospital, even when they probably should have. For rural hospitals, that was a big financial hit. According to the American Hospital Association, there are 1,800 hospitals in rural communities across the U.S. During the past 10 years, about 130 have shut down. So what's going on? Healthcare organizations say the reasons are many. Shrinking populations, cuts to Medicare reimbursements, increases in indigent care, and rising operating costs. Bottom line, losing a rural hospital means losing a lifeline.
Rural community hospitals just serve generally a poorer, sicker, tougher demographic group than urban parts of the state.
When Rockdale lost its hospital, Chief Rodham and his volunteer fire department had to pick up some of the slack. Why? Rockdale sits in Milam County with a population of 25,000. And get this, there are only 3 ambulances in the entire county. That's it. You heard right, just 3. And the nearest hospital to Rockdale is 30 minutes away.
We had taken on some of that burden responding to emergency medical calls to try to do minimal basic first aid or basic medical care on these patients in their time of need until an ambulance could come from another county. Sometimes that would be 30 minutes, sometimes that would even be up to an hour.
Access to care matters, and when you're having a heart attack or a stroke and you find yourself 60 or 70 miles from care, you're going to have worse outcomes.
Henderson says when a hospital closes, the impact is far-reaching, far beyond just the loss of health care.
When a rural hospital closes, it's not just the hospital and 100 jobs that go with it. It's that the whole community falls down, and you lose your pharmacy, and then you lose your clinic, and you lose your bank, and you lose your grocery store. And we see hospitals as an anchor, as foundational to rural economic development.
Just ask the people of McKenzie, Tennessee. The hospital here closed 3 years ago. It was one of 13 to shut its doors in Tennessee since 2010. Only Texas had more closures.
Would you make sure that somebody from the police department writes a Church of Christ thank you note?
Mayor Jill Holland says losing the hospital and its 250 employees has been devastating.
The hospital was one of our largest employers, and a lot of the staff, they would eat their lunches and their dinners here. They would shop here in our stores. They would buy their groceries. They would buy their gas, and their children were in our school system.
The hospital was also a great selling point for Bethel University. Parents were comforted knowing health care for their kids was nearby. Gary Simmons is chairman of Mackenzie's Industrial Board.
They knew there was a hospital 5 minutes down the road, and we don't have that to offer anymore. It would cost so much money to go in and build a hospital from scratch that I don't think we'll ever have another hospital.
That's made it difficult on the staff at Bethel. Garrett Burns is the associate chaplain at the Christian University.
Did y'all get to visit them or just through the window?
Burns says he's upfront when he meets with parents.
I'm very transparent with parents when they come here. I'll tell them that, we've recently had a hospital closure. This is something that's happened in a lot of communities, but we have a clinic on campus. Our urgent care has extended some of that care to the clinic.
For the people of Mackenzie, attracting new industry here since the hospital closing has been next to impossible.
The difference in losing a rural hospital and an urban hospital is that our building is vacant. We haven't had any other industry come in to look at that building. It's just sitting there empty. And as someone who is a part of some of the committees in our county and within our industry, that grieves me and it worries me about the future of my children.
Whenever an industry is looking at coming into a town, one of the things that they do is look at the medical care. And they may not tell you, but immediately you go to the bottom of the list if you don't have a hospital.
The closest hospital is less than 30 minutes away. Not awful, except when the weather's bad and the road floods. Then it's a good hour's drive. So what if you live in a rural community where you may have to drive 30 miles or more just to see a doctor or go to a hospital? Well, there's a Florida company called OnMed that may well be revolutionizing the future of rural medicine.
It's ADA compliant. You have a ramp as you come in here.
Right.
And when you walk into the OnMed station, you can see you have a scale in the floor.
That's the scale.
That's the scale in the floor.
Austin White, CEO of OnMed, believes his company's telehealth station can revolutionize medical care. From the moment the patient begins the virtual consultation with a licensed physician based at the Tampa, Florida headquarters.
Hello, welcome to the OnMed station. My name is Jessica. Before we begin, I'm going to be magnetically securing the door and fogging the glass for your privacy.
They will greet you, walk you through your medical history. They will ask you to sign a release form that you're going to be seen via telemedicine, and you acknowledge that. And we do your medical intake.
Inside the station, your blood pressure, weight, height is taken. Thermal imaging provides your body temperature. There's also a handheld camera. The clinician can direct you to hold it up to your eyes, nose, or on your skin. There's a stethoscope, too, and a couple hundred of the most common prescriptions are stored in the OnMed station and can be robotically retrieved and dispensed. And right from here, you can dispense.
This is where the dispensed medication comes out. When we look at all those components, that's more components from a diagnostic capability than most walk-in clinics have, by a long shot.
To demonstrate its potential in rural communities, OnMed is working with Texas A&M University. One of its units has been deployed to Milam County, where the city of Rockdale is.
Milam County has 25,000 residents. They have 5 primary care physicians. They have no urgent care, and the 2 hospitals that they had in the county closed inside of 14 months from each other.
What makes you think that they're going to want to walk into that booth?
They don't want to drive 30 minutes to an hour and a half to go see a doctor.
Can you be open 24/7 with these or not?
Absolutely. So right now we're open 12 hours a day, 6 days a week. The goal is to be 24/7 by the end of 2020.
Besides rural settings, White believes the OnMed stations will work on university campuses and at places like airports and convention centers. And much of the interest is coming because of COVID-19. So has COVID really rewritten telemedicine and, in your opinion, made OnMed even more desirable than it ever might have been?
What COVID has done to advance the knowledge of telehealth and telemedicine and telepharmacy to the average person has been staggering.
Back in Rockdale, Texas, there's a clear understanding that losing your hospital is a gut punch.
When we lost the hospital, we lost a pillar of the community for sure.
Telemedicine can't replace hospital care, But for rural communities, it may well be just what the doctor ordered.